Good morning, everybody, and welcome to our daily COVID-19 briefing on Thursday, May 21. I am joined with my partner, Mary Bauman, and today we are going to be discussing some unprecedented IRS rule changes with respect to Section 125 cafeteria plans, and we will also touch on some updated high deductible health plan guidance that was given at the same time. Like usual, before we get started, we'll go through just a few updated statistics in the last 24 hours. So worldwide, we have slightly over 5 million confirmed cases of COVID-19 with a little over 330,000 deaths. In the U.S., we have a little over 1.58 million confirmed cases and about 93,800 deaths. Narrowing down a little bit more specifically, we have about 52,000 or slightly more confirmed COVID-19 cases in the state of Michigan, with just a tad over 5,000 deaths. And then even more locally here in Kent County, we have just a tad over 3,000 confirmed cases, with 60 confirmed deaths. More recently, all 50 states now have started to reopen in some capacity, with additional restrictions that continue to be lifted. The number of global cases is actually growing higher, especially since countries like Russia and Brazil are seeing surges at this point. But on some good news, the daily deaths numbers have actually been decreasing. Again, going back to some local updates, Ford has temporarily closed a truck plant in Dearborn after a worker tested positive for COVID-19. And today, President Trump, on a related note, is expected to visit a Ford plant. And then lastly, the HEROES Act, as many of you know, passed this week in the House of Representatives, but continues to stall in the Senate. Having said that, there is increased support for another round of stimulus checks to individuals. With that, we will move on and jump into our material for today. Jeff, there we go, advance the slide. So today's topics, as you can see, the IRS has basically increased the flexibility for participants to make pre-tax election changes under Section 125 cafeteria plans. And both Mary and I will probably refer to Section 125 cafeteria plans as either Section 125 plans, cafeteria plans, or flexible benefit plans. To the extent we use those interchangeably, they all mean the same thing. This guidance also delayed the deadline for participants to incur medical and dependent care expenses for some health and dependent care FSAs, and we'll explain which ones those are as we go on. And as I said, the IRS also issued additional clarification regarding the testing and treatment of COVID-19, as well as the coverage of telehealth and virtual health visits covered by high deductible health plans. And finally, for Health FSAs that allow a carryover, not a 2.5-month grace period, that carryover has been increased from $550 to $550. From $500 to $550 for 2020 plan years amounts being carried into the 2021 plan year. Before we move on, I will note that we did issue a pretty substantial client alert on these IRS notices and the guidance, and that is available on Miller Johnson's COVID website.
May 15, it was posted. That's really good.
Thank you, Mary. Moving on, so this guidance came in two IRS notices. I would say one of the notices, which was 2020-29, contained significantly more relief for plan sponsors than 2020-33. 2020-33 really only clarified that Health FSA carryovers could be increased to $550. It also touched on some various relaxed rules for these new individual coverage HRAs when they have to reimburse premiums that may fall outside of the ICRA plan year. But because we think those are still rare arrangements, we're not going to spend any time on that guidance today.
But the first piece of guidance, Tripp, 2029, is also limited in that it's a one-hit wonder, right? 2020, not beyond for the first two changes.
Correct, and we'll explain that. And so some of the flexibility only applies for these mid-year pre-tax election changes during calendar year 2020. And again, we'll clarify that, and that would include those cafeteria plans that have non-calendar year plans. Next slide, please, Jeff. So those of you that are familiar with cafeteria plans, you may know that generally elections must be made before the cafeteria's plan year begins. There is some exceptions to that rule. One is specifically for new hires. They may be allowed to make elections during a plan year after they are hired. And once those elections are made, they must generally be irrevocable during the plan year unless a participant incurs what we are going to refer to as a permissible mid-year change event. I think some examples of these permissible mid-year change events are change in status events, also I think formally referred to as change in family status events. So situations of where you may have employment changes that affect your eligibility for your employer's health plan, family changes such as births, marriages, divorces. Another example would be any HIPAA special enrollment events, so losses of other coverage. Again, a new dependent by marriage, birth, or adoption, or placement for adoption. And then finally, the entitlement to Medicare or Medicaid. And please let me point out, these are just examples of permissible mid-year change events. There are a number of them under Section 125, which governs cafeteria plans. Cafeteria plans are not necessarily required to have all these mid-year permissible change events in their plan, but
most do.
Mary, most do. I have yet to run across one that skips one unless that omission was inadvertent. Next slide, please, Jeff. So really, the big change under IRS 2020-29 is with respect to employer-sponsored health coverage. A participant in calendar year 2020, and again, this is regardless of when the cafeteria plans year, the participant may make a mid-year change event regardless of whether the participant incurs one of these permissible mid-year change events. So the notice 2020-29 specifically points out that an employer could elect to enroll in employer-sponsored coverage mid-year, absent a mid-year change event. They could also elect to change coverage options or coverage tiers, such as moving from single to family coverage for coverage options offered by the same employer. And third, they could elect to revoke coverage under the employer-sponsored health coverage as long as the employee attests to having coverage, other major medical coverage from another source when they request revocation or attest that they will immediately enroll in other comprehensive coverage. Next slide, please, Jeff. So I think one of the most important things to note is these changes are optional to the plan sponsors of cafeteria plans. You are not required under these notices to allow participants to make these mid-year changes unless you want to. And I know that because of some of the challenges presented by COVID-19, employers are trying to be increasingly flexible to employees, but I think, as Mary is going to explain, there's some considerations that I think employers should, or some factors that employers should consider, I should say, before an employer decides to allow these types of changes. And Mary's going to dive into this in much more detail, but let me point out that Notice 2020-29 really only permits a participant to change the amount of the participant's pre-tax elections mid-year under a cafeteria plan. It does not entitle a participant to make mid-year election changes with respect to benefit enrollment. So, for example, if I'm an employer that wants to allow an employee to enroll in coverage mid-year, unless that individual has incurred a HIPAA special enrollment event, Notice 2020-29 is not going to require the insurer or stop-loss carrier to allow that participant to enroll mid-year. Next slide, please, Jeff.
Okay. So as Tripp mentioned, so first of all, remember this is optional and it's only for 2020. Why? Because the feds are trying to be responsive to employees affected by COVID-19. So if you want to go through all of this, it's not like it's going to be an indefinite thing. This is just for 2020. And then as Tripp pointed out, yes, if I have a loss of other coverage or I have a new dependent by birth, adoption, placement for adoption, and then there's some other Medicare-related events. But in general, absent one of those, in those situations, the insurer or stop-loss carrier, if you're self-funded, has to allow me to come onto the plan. So newly enroll in the plan and arguably newly switch options. But absent that, the insurer or stop-loss carrier doesn't have to allow that. Usually they'll always, of course, allow dropping coverage mid-year because there's no adverse selection downside to letting people get off. But in terms of getting on, that's when we have a concern by the insurance carrier. Why do you want to add coverage now? Now, we have noticed that during COVID-19, we have seen a lot of flexibility by insurers for fully insured plans and stop-loss carriers for self-funded plans, saying, you know what, we're going to allow extensions of benefits during layoff or furlough. We're going to, be very flexible in terms of adding people onto the plan. However, those are really, I would say, unusual. So we don't know how much longer carriers are going to be open about this. Obviously, they're experiencing favorable underwriting experience right now because people aren't getting elective surgeries and other procedures, so their costs are a little bit down. But, in general, that's something that you would want. So before you decide you want to do this, first thing you got to do is check it out and see if the insurer or stop-loss carrier is going to play ball with you. Next slide, please. So the other thing that the IRS pointed out in this guidance is if you decide to allow this, it's not an all or nothing decision. In other words, you can allow this with some restrictions, with some discretion. And here's some examples of where they said you might want to do this. And these might particularly resonate with the insurer or stop-loss carrier. First of all, we'll allow you to make an election change that might result in increased or improved coverage. For example, I'm in a high deductible health plan right now. I want to go to your PPO plan because it provides more comprehensive coverage. I'm very worried about COVID, and I want to make sure I have comprehensive coverage for myself and my family members. So that might be an example that would be logical, as opposed to the other way around.
Well, Mary, I think you made a good point. Yeah. I think the other way, if you're going to consider it, not that you couldn't allow a change from, a traditional plan to a high deductible health plan, but I think you also, from an administrative perspective, have to think about what does that do to tracking my deductible,
maximum out of pocket, et cetera.
Yeah, and may have already, been reimbursed under the traditional plans. Now going to transfer to the high deductible health plan. So that might be another reason only to allow a transfer from the HDHP to the more traditional PPO plan.
Right. And of course, the other issue is, remember, if you let somebody into a high deductible health plan mid-year, we want to make sure that they are eligible for the related health savings account. And if they have, for example, a general purpose medical FSA or, some other coverage, that is going to potentially disqualify them. So you want to think about letting people getting into a HDHP mid-year is always a little tricky. Another change that you might want to allow is allowing people to add dependents. Tripp already mentioned this. So I'm currently in single coverage. My spouse was eligible before, but maybe had waived, or maybe, had other coverage, but it was crappy. Now I want to add my spouse onto coverage. You could allow that, or a dependent. Another change would be to say I'm going from a low option, let's say a plan that only has in-network coverage, to a high plan with in-network and out-of-network coverage. And then one other example is that this guidance is interesting in that it says, with respect to employer-sponsored health coverage, and it doesn't precisely define what that means. Both Tripp and I think that when you looked at the guidance as a whole and what it's referring to, it does include medical, dental, and vision. You might decide, I'm going to allow this for medical, but I'm not going to allow it for dental and vision. And of course, the other issue is the administrative hassle of going through all this. Next slide, please. Now, what about dropping coverage? Yeah, you could allow people to drop coverage. Again, it's optional. As Tripp mentioned earlier, you have to have them attest in writing that they have other comprehensive health coverage from another source. And as Tripp pointed out, if you Google this notice, there's sample language in the notice to use for this purpose. You'll see in the sample language that comprehensive health coverage from another source might be other employer group health coverage, but it might be something else like Medicare, Medicaid, TRICARE, coverage on the exchange. So it's from a variety of sources. Now, having said that, if they attest in writing that they have other coverage or they're going to immediately get it, employers can rely on that, take it at face value, unless you have actual knowledge that it's false. So if you know the employee is lying to you, I don't know exactly, Tripp, how that's going to happen. Maybe the person tells an HR representative in a casual conversation that I'm just, joking, haha, and I'm not really going to get coverage. I don't know how you do that, but that would be what you'd be concerned about.
Correct.
And then on the flip side, carrying this forward, if the person wants to drop and they say I'm dropping because I'm going to immediately enroll in other coverage, the other coverage may have special enrollment rights rules to only allow mid-year enrollment in certain prescribed situations and not just for any voluntary reason. And so the person may say they're going to get other coverage and they may not actually be able to get it. So that's another consideration.
Hey, Mary, an interesting question just came in, and I only want to bring it up because it relates specifically to what you're talking about. And the question is it okay to drop dependents? So, for example, changing from family tier to single tier without requiring the dropped dependents to have other coverage, or I think by extension of that, having the employee attest that the other that the dependents who are dropping coverage have other comprehensive coverage. I think my recollection is that the notice is completely silent on attestation.
It is. It refers to the employee. Yeah.
So I think under a strict interpretation of the notice, you're not required to get an attestation that any dependents have other coverage. No. But since remember, you can limit it, you could actually say no. We're going to self-impose that requirement, and there may be reasons again for doing so to make sure that these dependents do have coverage during this time.
So for example, Tripp, let's say that I'm going to drop my spouse because of this rule. Well, the reason I'm dropping my spouse is because he was cheating on me and moved out, and I know we're getting a divorce. Well, don't forget, guys, that if somebody drops in anticipation of a divorce, later on, you're going to have to offer COBRA to that spouse. So if you want to let a spouse drop, then you may even need to, send out a COBRA notice. And then, of course, what if there's a divorce situation and there's a court order, like a qualified medical child support order in place, or something that requires the employee to carry the child? and then the employee comes in and says, I think I want to drop my employee. Can't circumvent, I think, other laws to take advantage of this.
Exactly.
Tripp, I'll turn it back over to you. Next slide, please, Jeff.
All right. The IRS flexibility does not stop with mid-year changes just related to employer-sponsored health coverage. They extended it, maybe not surprisingly, based on this massive flexibility they just gave us, to health FSAs and dependent care FSAs. So now participants can make mid-year changes with respect to their health FSA or dependent care FSA, again, regardless of whether a participant incurs a permissible mid-year change event.
But again, just for 2020, right, Tripp?
Just for the 2020 calendar year. So again, if you are operating a cafeteria plan and a non-calendar year plan, this flexibility applies to you, but it would only apply to mid-year election changes during the 2020 calendar year. So the specific mid-year election changes that the notice allows is to elect to enroll or revoke enrollment in a health or dependent care FSA mid-year. It also applies and would allow a participant to increase or decrease participant contributions to a health or dependent care FSA. Next slide,
Tripp,
please, Jeff.
Tripp, I have a question for you on dependent care FSAs. We know that under current mid-year election change rules, if I have a change in the cost of my child care or dependent care, I can make a corresponding change in my dependent care FSA, and that the IRS has interpreted that very, very broadly. Do you think I even need to do this because of that for dependent care, because of that special rule?
I don't think so. So, we've gotten a lot of questions, obviously, a number of daycare facilities have closed around the nation. And therefore, and a lot of those daycares have waived the cost of coverage while they're closed. So a lot of employees have said, okay, well, I didn't necessarily, when I made my, $5,000 contribution to my dependent care FSA, I didn't expect for my kids to not be going to daycare for multiple weeks in 2020. So can I decrease my election in my dependent care so I don't forfeit a bunch of money at the end of the year? And that was all, a cost change in a person's dependent care situation, like a daycare, has always been a permissible mid-year change event. Okay. So, even without this increased flexibility, at least with respect to dependent care FSAs for this situation, I don't think that this guidance was absolutely necessary. But I think, again, the flexibility is intended to be as broad as possible.
Yeah. So if you don't want to do anything, guys, if you don't want to do anything to your plan in response to this, but you still want to allow dependent care FSA changes, you're probably fine.
Exactly.
That's all I wanted to point out.
So I think we cover this, but at the risk of being repetitive, these, just like the mid-year changes with respect to employer-sponsored coverage, the changes to health FSAs and dependent care FSAs, allowing these mid-year changes without a mid-year change event, is optional. And so again, like Mary talked about, there's other reasons things that an employer should consider if they decide to allow these changes. So remember, health FSAs, not dependent care FSAs, but health FSAs are subject to the uniform coverage rule, which basically means that at any point during the health FSA plan year, I need to be entitled to reimbursement from the health FSA up to my full, the maximum amount in my health FSA. So let's say for 2020, I decided to contribute the maximum, which was $2,750. And I made that election. It was effective January 1. And let's say January 15, I put in $200 to my health FSA. If I incur a out-of-pocket medical expense of $3,000 on January 15, I can submit that entire expense and be reimbursed up to my full $2,750 election on January 15th, even though I have not put that much money in. So what the uniform coverage rule can create is the ability for a participant's Health FSA account balance to be negative. So what we need to remind employers, and what you need to think about, is if you are going to allow participants to decrease participant contributions to a Health FSA, you shouldn't allow that decrease to be below the amount that the participant has already been reimbursed. Otherwise, that's going to create a loss to the employer. And frankly, Mary, I think if we have employers that allow decreases to participant contributions to a Health FSA, that may be a fairly popular election by participants, because if I was planning on having some elective procedure, now maybe I can't have it because of all of the restrictions on elective procedures in various states. And so maybe I want to decrease that because I have to indefinitely put that off. So if you're going to allow this decrease, I think you have to remember, let's not allow, at least with the Health FSA, to decrease that below the amount that's already been reimbursed.
Yep.
Next slide, please.
I agree. Yep.
All right. This is a little bit, and this is another consideration that employers should remember. It's really, I think, Mary, for employers that actually make employer contributions.
Yeah,
to a Health FSA,
for most of you, this doesn't even apply. For most of you, this. And
I would say that this is kind of where we nerd out a little bit. But this is something that could be a big deal for employers who make employer contributions. Remember, in order for a Health FSA to comply with the Affordable Care Act requirements, it can't. So it really has to be an accepted benefit so that it doesn't have to comply. And there's two requirements to be an accepted benefit. The first is the availability condition, which basically means only employees who are eligible, not necessarily enrolled, but are eligible for the employer's major medical plan are eligible for Health FSA. And more importantly to to our conversation today is the maximum benefit condition. And that is the maximum reimbursement from an FSA, including employer contributions, can exceed the greater of $500 or 2 times the amount of a participant's contributions. So if you think about it, if you allow the maximum participant contribution in 2020 and a participant contributes $2,750, the employer cannot make a contribution of greater than $2,750 on behalf of that participant in order for the FSA to remain an accepted benefit. Next slide, please, Jeff. So it's unlikely, because of the uniform coverage rule, which we explained, and ERISA's exclusive benefit protections, that once an employer makes Health FSA contributions, that those contributions can be returned to the employer. They likely have to remain in the employee's Health FSA account. So if an employer allows an employee to make or to decrease their Health FSA contribution, the decrease should not be permitted below the amount that would fail to satisfy the maximum benefit condition. So obviously there's going to be some math there, but I think for those employers, again, I think it's probably in the minority that provide employer contributions. This should be another thing on your radar. Again, the last bullet point is just to reemphasize that these health independent care mid-year election changes are, again, optional.
Optional, right.
Next slide.
So, Tripp, one of the questions that was submitted before our webinar this morning began was, can the extension be earlier than December 31? And it seems to me the answer is yes. So in other words, if I wanted to say, we'll let people make changes until October 31, but not until December 31, I suppose that would be okay. Would you agree?
Yeah, so I think we should address this, in this next section as well, because I think the question, that's a great point, but I think the question was also getting at this next session about the extension of deadlines with respect to certain Health FSAs.
And then the other question was, can employees make multiple mid-year election change requests through the remainder of 2020? And I suppose the answer is yes, per the guidance, unless the employer decides to be more restrictive and say, you can make one change. Would you agree with that?
Exactly. I was just, since I'm kind of kicking over the presentation to you, I was just typing in an answer to someone that asked that. And I would absolutely agree with you. There's no limitation to making only one election change in the guidance. But since the guidance specifically says the employer can put their own limitations, I'm sure the employer could say, listen, we're going to make, you can make these election changes regardless of incurring permissible mid-year events. But you only can do it once. It's one and done. Yeah,
one and done. Right. So that's again a plan design issue. Okay. So now in this slide, we're talking about some of the documentation requirements. If you want to do any of the changes that we just talked about, you can do it, but it's at your option, and you must affirmatively amend your Section 125 plan, cafeteria plan, flexible benefit plan document. And fortunately, the guidance gives you ample time to do that. You can do it by December 31 of next year, and it can be retroactive back to January 1 of this year. And then until you amend your plan, you just can operate it in accordance with what you decide to do. Now, having said that, you want to also make sure, obviously, that you communicate your rules to participants, and you do so promptly, because otherwise they won't have the opportunity to exercise any of these new options. So just something important to emphasize. Next slide.
Mayor, I was going to ask you, are there any notification requirements with respect to if an employer implements these changes?
And I don't know if I recall anything specific in the guidance other than to notify participants.
Yeah, it does. It basically says if you make these changes again, you have significant time to amend your plan, obviously, but you should notify your participants.
Yeah.
And as we point out, the IRS in our client alert and linked to a previous client alert, the IRS and DOL have basically said during the outbreak period, which we talked about in a previous client alert, it's going to take a relaxed enforcement position with respect to notification requirements. Really what that means is potentially you can notify participants in these plans, even electronically of these changes. But again, there's no deadline on when you should do that, but I would say, probably
earlier the
better. As possible, so people know that these opportunities are out there.
Absolutely. Okay, now we're going to kind of switch gears a little bit to the next piece of the first notice. And this is regarding the opportunity to basically incur additional eligible expenses either under a medical or dependent care FSA, again, to minimize any forfeitures. And this is a COVID piece of relief. And I think the most important thing for you to remember is the difference between incurred and submitted. So remember, in general, you need to incur claims, and that means actually, the charge is now owing because you had the service or supply was rendered during the plan year. But then most employers have what I call a runout period at the end of the plan year to say, and by the way, you've got a period of time after the plan year ends, maybe it's 90 days or 3 months, to submit the claims which were incurred during the plan year. And then there are 2 important exceptions to that rule, both to minimize forfeitures. One is the 2.5-month grace period rule, which applies to both medical and dependent care FSAs and gives you the opportunity for 2.5 additional months after the plan year ends to incur claims that will relate back to your balance from the plan year just ended. And then typically employers will have a runout period after the grace period to submit those claims. And then the second exception to the general rule is the carryover. Now, as this slide indicates, that only applies to a healthcare FSA, not to a dependent care FSA. And that is the $500 carryover, which Tripp is going to be talking about the enhancement to $550 in just a little bit. Next slide, please. So I guess I should say before we, well, what I should say is on this last slide, Jeff, before I went on, and that is this allows you to have relief for plan years and grace periods that occur during 2020 to be extended until December 31, 2020. So if you think about this, folks, if you're a calendar year plan for your flexible spending account, your plan year already ends on December 31, 2020. So this would only benefit you if you happen to have a grace period that ended in 2020 for the 2019 year. Otherwise, this relief is really designed to mostly benefit non-calendar year FSA programs. Next slide, please. Tripp gave me these slides because he knew that they were the most difficult to explain, and he says to have fun with that, Mary. Okay, so for plan years and grace periods that end during calendar year 2020, participants, you can amend your plan if you want to, optional, to allow participants to submit claims that are incurred. Remember, I'm again using the word incurred, so service or supply rendered on or before December 31 of this year, for basically reimbursement from your account balance for the previous plan year. And again, as I just mentioned earlier, this relief doesn't benefit a calendar year FSA program where they don't where there's no grace period. So if you are a calendar year plan with no grace period, maybe this is the time for you to get a cup of coffee. This also does apply, by the way, to a Health FSA with a non-calendar year plan that offers a carry forward, the $500 carry forward, and I'm going to explain that now in some of our examples. Next slide, please. So we've got a couple examples here for you that hopefully will make this more real to you. And again, remember, this is only for 2020. This is not something that is going to survive 2020, but this is designed to help people minimize their forfeitures. I think, Tripp, we did have another question that was submitted in advance that said, gee, are we going to get any relief which would allow refunds of unused FSA account balances to employees? I think this guidance is really intended to address that concern. Do you see that any differently, Tripp?
No, I don't anticipate that relief coming. I know that this touches on a issue that the IRS is generally very sensitive about, I would say, even during the COVID-19 pandemic, because they did briefly mention this concept in this IRS guidance, and that's the kind of this deferral of compensation. So if I allow plans to basically refund unused amounts that would otherwise be forfeited, I would think that would fall squarely in kind of the IRS's concerns, right, that that change would allow an impermissible deferral of income.
Yeah. So I made the pre-tax contribution in 1 year, and I got the refund in a later year, which would be a deferral of income. Okay, so here we go on a couple of examples to illustrate this. Let's say I have a Section 125 plan, and my FSAs run on a July 1 through June 30 plan year basis. I also have the 2.5-month grace period, both for healthcare and dependent care FSAs. By the way, your plan might only have this for your medical FSA and not your dependent care FSA, and that is a matter of plan design, which is fine. So if I have the 2.5-month grace period, that means that eligible expenses for the year ending June 30, 2020 can be incurred until September 15, 2020. That's the 2.5 months. Now I can optionally elect to modify my plan, amend my plan to extend that September 15 deadline to December 31, 2020. And so in other words, as a result, any expenses that I would incur up until December 31, 2020 can then be reimbursed from my flexible spending account balances for the year ending June 30, 2020. And again, the intent is to prevent me from having any forfeitures from my account balance for that plan year just ending. But this is not something that I can do again for next year, folks. This is just a 2020 deal. Next slide, please. Now, here's another example, and this is an example with the $500 carryover. And again, remember that the $500 carryover can only apply to a medical healthcare FSA and not to a dependent care FSA. So let's assume the example that we just had, except for the 2.5-month grace period, that only applies to the dependent care FSA, and the healthcare FSA has a $500 carryover because you can't have both. You only can have one or the other. So same rule as just we went through in our last example on the dependent care FSA. We can move that September 15, 2020 deadline to incur claims to be deplete my account balance for the plan year ending June 30, 2020 through December 31, 2020. So we can lengthen that period. Now, what about the healthcare FSA with the $500 carryover? And as we say here in the slide, 550 because it's going to be increased, and Tripp will talk about that. So for that, the June 30, 2020 deadline is extended to December 31, 2020. And then if they have an account balance as of December 31, 2020, up to 500 or 550, depending on the employer's election, can be carried forward to the plan year that starts on July 1, 2020 and ends on June 30, 2021. Was that as clear as could be, Tripp?
I think I would have a tough time making any clearer. I think the way that I think about this, if you're a calendar year plan and you don't have any grace period in your plan, this isn't going to apply to you. If you're a non-calendar year plan, then you can think about whether you want to extend your claim submission deadline to the end of 2020. And if you're a calendar year plan non-calendar year plan that allows a grace period, carryover, it potentially allows you to kind of take advantage of the grace period and the carryover in the same year, which is generally not permissible. Having said that, before we move on, though, I think we should address kind of the question that we addressed earlier with the election change events. Could an employer say, okay, I want to, I'm eligible to use these extensions. Could I potentially limit these extensions so that, not necessarily to December 31, but maybe earlier in the 2020 calendar year? And I think the answer again to that is absolutely.
Yeah. I agree. I agree. Yeah. Go ahead.
We got one other question, but if you had something to add on that, I was going to defer to you.
Go ahead.
So does the outbreak period, remember in our previous client alert, we talked about how the outbreak period extends certain limitation periods under ERISA. So does the outbreak period extend the claim submission deadlines for ERISA health plans also extend to Health FSAs? So I think I think we got to be careful. Remember, the outbreak period extended, claim submission, so the run-out period. But it didn't apply to an extension to the time to incur the claim. So, if you had a plan year that ended on April 1 and didn't provide, Health FSA didn't provide any grace period, you still had to incur expenses by March 31st. But if it allowed a 90-day period after March 31st to submit those claims for reimbursement, that 90-day period was extended. Now, if you take advantage of these claim extension guidelines under this guidance and still allow a run-out period, there may be some ways that those interject with each other, right? So now I have until December 31 to submit to incur medical or dependent care claims expenses. And then to the extent the outbreak period lasts into 2021, maybe the run-out period is then extended after that.
Right. So I think the important thing for people to remember is the difference between the time to incur the claim, which could include a grace period or a carryover, and the time to submit a claim, which we sometimes refer to as the run-out period. That's submitting a claim that was timely incurred. And the other guidance on the outbreak period only applies to the latter, meaning the time to submit the claim that has already been incurred.
right, should we move on to the Health FSA carryover increase? Next slide, please, Jeff. So, just to get a little bit of background here, is beginning in 2013, Health FSAs were allowed to use a carryover of a participant's unused Health FSA account balance. The carryover did not apply it did not and does not apply to dependent care FSAs. We should also note that a Health FSA can only offer a carryover or a grace period, but they can't offer both. And what a carryover really does, it says if a participant's got an account balance, at the end of the plan year, they can carry over up to $500 of that account balance to be used in future plan years without being forfeited. And employers, I just want to note, employers were allowed to permit or impose limitations on that carryover. So, for example, they could have only allowed $250. Now, I'm not aware of any employers that generally limited that amount further to $500, but that was permissible. So obviously this carryover has been around for a number of years now, but it was always, it was never indexed for inflation. So it continued to be $500 from year to year. Next slide, please, Jeff. Switching gears a little bit, notice 2020-33 basically said, well, now we're going to index the carryover amount of up to $550 for 2020 plan years, for carryovers from the 2020 plan year to the 2021 plan year. Again, employers can set a lower limit. And what I think is also notable is this amount will continue to be indexed for inflation in the future. And that index, Mary, is going to be tied to the indexed amount that is applicable to a participant's salary reduction contributions to a Health FSA. So what IRS
So in other words, Tripp, since we haven't had any adjustment of this since this first came out, but now you think we're going to probably get this more, it's going to be adjusted upward probably more frequently.
Correct. And the way the IRS said they're going to do this is they looked at the cap on participant salary reduction contributions back in 2013 was $2,500. And so the $500 carryover represented 20% of that cap. So as the cap increases, so will the carryover amount. And because the cap on salary reduction contribution is indexed, and it has been every year by at least 50, by multiples of 50, so I think it's increased every year by $50. The carryover will generally be increased in multiples of $10, which of course is 20% of 50. Next slide, please, Jeff. Okay, shifting gears entirely, we got some, I think, important and helpful clarification on various expenses covered by HDHPs, which will generally not jeopardize a participant's the HDHP's status as a high deductible health plan, and therefore it will not jeopardize the HSA eligibility of participants in that high deductible health plan. So generally, a high deductible health plan can only reimburse a participant's non-preventive care expenses once a participant incurs a minimum deductible. And in 2020, that minimum deductible for self-only coverage was $1,400, and for other than self-only coverage was $2,800. And quickly to step aside here and give you a news alert, just yesterday, the IRS released the updated or the indexed HDHP and HSA contribution limits for 2021, and these minimum deductibles did not change for 2021. So they will be $1,400 and $2,800 in 2021 as well. Next slide, please, Jeff. So in IRS Notice 2020-15, the IRS provided very helpful guidance and said, listen, if a high deductible health plan covers a participant's expenses for basically COVID-19 testing or treatment before the individual satisfies the minimum HDHP deductible, we're not going to treat that as a disqualifying reason for purposes of the HDHP. So the HDHP can do that and still be a high deductible health plan, and participants in that high deductible health plan will remain HSA eligible. Notice 2020-15 was released on March 11, 2020, and was really silent. While it didn't have an end date, it was really silent as to its applicability date. So I think some plan sponsors and carriers that offered high deductible health plans said, well, what if we reimbursed a participant's COVID-19 testing or treatment services without the imposition of the minimum HD deductibles before March 11? Are we in trouble then? Next slide, please, Jeff. And importantly, and notice 2020-29, it clarified that this guidance in 2020-15 applied retroactively to January 1, 2020. So this was very helpful. So if a high deductible health plan covered, for example, certain COVID-19 testing or treatment for a participant on January 15 of 2020, regardless of whether the participant satisfied the minimum HDHP deductible, the HDHP remained a high deductible health plan and the participant remained HSA eligible. Next slide, please, Jeff.
Probably not too many Americans having that testing done on January 15, but you never know.
Yep. 2020-29 also clarified the permissible COVID-19 expenses that can be provided by a high deductible health plan without the imposition of the minimum deductibles. And that includes diagnostic testing for influenza A and B, norovirus and other coronaviruses, and then RSV. So those services can also be provided retroactively back to January 1, 2020 by a high deductible health plan without jeopardizing the plan's high deductible health plan status. Notice 2020-15 was issued before the FFCRA, the Families First Coronavirus Response Act, or the CARES Act. So 2020-29, which I think was fairly self-evident without it, just clarified that any item or service required to be covered by a health plan with no participant cost sharing could also be covered by a high deductible health plan without jeopardizing the plan's high deductible health plan status. Next slide.
And also just to remember, folks, on your HDHP, you have to cover the testing and the related visit, but the treatment for COVID, coverage for that is optional if you want to do that on a first dollar basis. So that's a design decision that you need to make.
Correct. Great point. Great point. So the FFCRA required COVID-19 testing to be covered by all participant cost sharing all health plans with no participant cost sharing, including deductibles, and in all settings, including virtual visits like telehealth. Very quickly after the FFCRA was released, Mary, I think we heard a number of rumors that telehealth providers generally couldn't necessarily determine whether a telehealth visit was for purposes of COVID-19 testing or, to the extent possible, treatment, or whether it was for generally any other medical care service. Next slide, Jeff. So high deductible health plans were left with kind of a difficult choice. Did they violate the FFCRA and not cover COVID-19 testing and treatment under virtual visits with no participant cost sharing, or jeopardize a health plan's high deductible status by covering all medical services without participant cost sharing, which would comply with the FFCRA, but arguably would violate the rules that apply to high deductible health plans. The CARES Act was shortly passed after that and provided, I think, very significant clarification, said basically through the a health plan's plan year that begins on or after January 1, 2021, the health plan can cover all telehealth services without the application of the minimum high deductible health plans, and it won't jeopardize the health plan's high deductible health status or a participant's HSA eligibility in that high deductible health plan. So again, that was very welcome. Next slide, please. But I think the lagging question, again, similar to our previous discussion, was the CARES Act changes were generally effective on March 18, 2020, which was the date that the FFCRA was effective. And so it left uncertainty for telehealth services provided by high deductible health plans before March 18, 2020. So again, notice 2020-29 clarifies that high deductible health plans can cover all virtual health services retroactive to January 1, 2020, and the health plan's high deductible status is not jeopardized, nor is the HSA eligibility of anyone in that high deductible health plan. Next slide, please, Jeff. With that, I think we will move on to questions. I've got a couple of them here, Mary. It says, if I have a calendar year plan with no grace period, can I modify the plan to add a grace period for the current year? Well, I think the answer
for the year ending December 31, 2020.
2020, so that the grace period will apply, allowing a participant to incur expenses for the first 2.5 months of 2021 and still be reimbursed out of the 2020 plan year account balance. But you can't add a grace period now in 2020 for purposes of the 2019 plan year.
Correct.
Does the increase in the carryover from 500 to 550 also apply to calendar year plans, even though the rest of these changes do not? They absolutely apply to calendar year plans. And I would be careful to say that these other changes don't apply to calendar year plans. I would say the only changes that we discussed through our whole presentation that may not apply to calendar year plans is potentially this extension of the time frame in which participants can incur medical and dependent care expenses and be reimbursed from the health or dependent care FSA. So I certainly don't want to give the impression that none of these changes apply to calendar year plans.
And Tripp, on the carryover, normally if I want to elect to increase that carryover or to add a carryover, I would need to do it before my to do it for this plan year, I would have to do it before the plan year ends. Do I still get that relief to December 31, 2020 on the 550 carryover if I want to implement it for this year?
Actually, you get a little bit more relief. So if you want to allow a carryover from the 2020 plan year into the 2021 plan year, you have to amend your plan by the last day of your plan's 2021 plan year. So if you think about that again, in terms of calendar year plans, if you want to allow the increased carry amount of 550 from 2020 into 2021, you would have to amend your cafeteria plan by December 31, 2021. Of course, you would have to operate your plan in accordance with that before the amendment, but you have an additional time to amend the plan.
Yeah.
With that, I think we've answered all of the questions.
Wonderful.
In just under an hour, too. We made it.
Wow. And if any of you are interested in no-fault reform, we've got another one coming up at noon.
Okay, one more question just popped up, so we'll quick answer it. If a dependent care account is not changed to allow election changes, and an employee is working from home, daycare is still open, can the employee still change their election if they are still working, albeit from home, and daycare is open, but the kids are not going because the parents are working from home? So I think to summarize this question is we're not going to amend our plan to allow the increased flexibility in mid-year changes. Daycare is still open. Mom and dad are working from home, so they're not sending their kids to daycare. Can they still change their dependent care FSA election under the general rules? And I would say, Mary, since the IRS seems to interpret this broadly, I think you have a defensible argument that that's still a change in the cost of your child's daycare because you're not sending them there anymore because they don't need to because of employment-related reasons.
I would agree. It'd be like if this wasn't going on with COVID and my husband has a change in his hours of employment, and so he and I are going to be working different schedules, and so we don't really need the daycare anymore. Same thing. I think, I think you can interpret it pretty broadly right now.
All right. With that said, like Mary mentioned, we have another no-fault webinar this afternoon at noon. So if you want to sign up, I believe you can do that on our website. To everyone else, thank you for joining us today, and we hope you have a good afternoon. Take care. Bye now.
Bye-bye.